welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluations at the close of today's program. Continuing education credits are available after you complete our short post-test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best meet your needs. As for today's program, we will be taking your questions throughout the hour by phone. Our toll-free number is 1-800-452-0662, or you can email us at any time throughout the hour at phlive.ny@gmail.com. Today's program is Comprehensive School Physical Activity Programs, Enhancing Student Success and Academic Performance. Our guest is Dr. Aaron Beighle from the Department of Kinesiology and Health at the University of Kentucky. Aaron, thank you so much for being here.
It's great to be here.
So we're going to be talking about comprehensive school physical activity programs this morning, and I would guess that if you were going to poll a random group of people, they would say, isn't this a gym teacher discussion? But I think you're here to start talking about how this really goes beyond the physical education classroom or what we used to think of as gym class. So can you start by talking about that?
Sure. I think it is. It's a much bigger approach than just physical education. I think physical education is a foundation, but a comprehensive school physical education program is an approach that allows schools to make a much more use of their time in getting kids active in a variety of ways, and this approach provides much more substantial opportunities to be active.
Great. So one of the movements to try to engage the larger community is through this Let's Move Active Schools campaign. Can you talk about what is an active school?
Yeah, the Let's Move Active School has really highlighted this whole comprehensive school physical activity program. The components of a comprehensive school physical activity program have been around for a long time. There have been people doing this for quite some time, and what this has done is it's brought it under an umbrella and allowed a more comprehensive approach to a more coordinated approach. And a comprehensive school physical activity program includes physical education, before and after school activity, physical activity during the school day, as well as family involvement and staff engagement as well.
So I'm going to play devil's advocate and say, why do we need such a comprehensive approach? I think, people my age or older certainly would say, well, when I was in school, we just had gym class. We didn't do it like this. So why do we need this comprehensive approach?
I think we've realized this for a long time, that all schools are unique and that all schools have a unique set of needs. And what we wanted to do with a comprehensive school physical activity program is essentially provide a menu of a variety of activities that schools can use to get students to be physically active. And it's multifaceted and it's comprehensive and it's a variety, it's a smorgasbord. Some things will work in some schools, some things won't work in some schools. And I think it's essential that we have a variety as opposed to saying this is the one way to do it. We need a variety of ways to do it.
And where is the support for this kind of approach? Is there, are there organizations or at the federal level? Are there folks that feel that this is beneficial?
Yes, fortunately with the Comprehensive School Physical Activity Program, that has garnered a lot of support. Mm-hmm. And the support is coming from, like the National Physical Activity Plan has it as an essential component of the education sector. The American Alliance for Health, Physical Education, Recreation and Dance, or AFERD, and NASPE have created the first position statement and have revisited that position statement. So there's support is ongoing. The National Football League with the American Dairy Council has their Let's Fuel Up and Play 60. And then ultimately, more recently, the Let's Move Active Schools has created lots of interest with comprehensive school physical activity programs.
Great. So certainly there's a lot of support that you're aware of.
Yes.
Now, at the national level, we can see that there's support, and we also have investment here in New York State at the state level. We spoke with Dr. Shah, the Commissioner of the New York State Department of Health, about our state's support of comprehensive school physical activity programs and how it fits within the New York State prevention agenda. So Dr. Shah, why should we support comprehensive school physical activity programs?
Regular physical activity promotes physical and mental health and improves aspects of academic performance in children and adolescents. The National Physical Activity Guidelines for Americans recommend that youth do 60 minutes or more of moderate to vigorous physical activity daily, including muscle and bone strengthening activities at least 3 days a week. Yet in 2012, only about 1/4 of adolescents aged 12 to 15 met these national recommendations. In New York, less than half of students in grades 9 through 12 do some kind of physical activity that increases their heart rate on 5 or more days per week, and only 1/4 on 7 days a week.
And why is a supportive physical activity environment important in the schools?
Although schools cannot prepare a healthy and educational future generation alone, they do provide the best opportunity for a population-based approach to increasing physical activity in youth. Children spend more time in school than in any other environment outside the home. This is the time when they're establishing healthy habits that can last a lifetime. Physical activity behaviors track from childhood into young adulthood, and physical activity in adulthood reduces the risk for many chronic diseases. School environments provide the best opportunity for students of all abilities to participate in physical education and both structural and unstructured physical activities such as active recess, classroom physical activity breaks, and walking and biking to and from school.
What is the connection between physical activity and learning?
Children who are more physically active demonstrate greater attention, faster cognitive processing, and better performance on standardized tests. There's also strong evidence that children who participate in daily physical education exhibit better school attendance, a more positive attitude towards school, stronger academic achievement, increased concentration, improved test scores in reading, writing, and math, and reduced disruptive behavior. Research also demonstrates that aerobic exercise has the greatest effect on student achievement and cognitive outcomes.
And what about the connection for public health?
Healthier students are better learners. Higher educational achievement and years of schooling result in better health. This is due primarily to the link between better educational and improved work and economic conditions, enhanced social psychological resources, and the ability to pursue a healthful lifestyle. Physical activity reduces the risk for heart disease, diabetes, osteoporosis, high blood pressure, obesity, the metabolic syndrome, and on and on. It improves various other aspects of health and fitness, including aerobic capacity, muscle and bone strength, flexibility, insulin sensitivity, and it reduces stress, anxiety, and depression.
How does supporting the comprehensive school physical activity programs align with New York State's prevention agenda goals?
The prevention agenda has the goal that by December 31st, 2017, we hope to increase the number of school districts that meet or exceed state regulation for physical education, which means at least 120 minutes per week of quality physical education in elementary grades K through 6 and daily physical education for children in grades K through 3. Interventions for consideration include opportunities to increase physical activity before, during, and after school, such as active recess and encouraging school transportation policies that support walking and biking to school, and implementation, monitoring, and enforcement of the State Education Department's learning standards for physical education and nutrition in grades K through 12. There are significant short-term and long-term benefits to making comprehensive school physical activity programs a high priority in our schools. To be successful, it will require a collaborative effort with many partners, including state and local public health, education agencies, school administrators, principals, teachers, parents, and of course students.
Great. Thank you so much for taking the time to meet with us today. So Aaron, clearly as you described, there's support at the federal level and our commissioner has described the support that we have here in New York State. How do the schools feel about this? Is there a benefit to the schools in getting involved?
Yeah, as was mentioned in the video, that there's no doubt that healthier students are better learners. We know that. We have lots of research. I think we've known that for quite some time because there's been a role of schools in public health with vaccinations and school lunches and things. I think what we're finding out more recently with some research from BASH in 2010 that we have lots of educational relevant health issues, things such as pregnancy and vision and hearing. And the ones that I think are really important are this whole idea of hyperactivity and physical inactivity and how they relate to physical activity being a leading health indicator. And we know from the video that there are health benefits of physical activity. The next step is to show schools that there are learning benefits, and I call it a physical activity as a leading learning indicator. And we know through research that if you give kids physical activity breaks throughout the day, their behavior problems will decrease and their attention spans will increase. And if you ask any classroom teacher if they can get kids to pay attention and listen and behave, they can teach them. And I think that's an important component for teachers to start seeing.
So quite a few of those learning indicators that you've referenced. You would say that there's a number of different ways that academically students benefit.
Absolutely. It's a twofold benefit because we know that the health benefits of physical activity, but we know the academic benefits of physical activity as well.
So has this been studied and tested?
Yes, there's some work from a very good visual of this from Hillman at University of Illinois that shows what the brain looks like with physical activity and what the brain looks like without physical activity. And obviously where there's red, there's more blood flow. And you can see kids that are active have more blood flow, and there's lots of evidence that increased blood flow is what we really need to help students academically and with cognition.
Sure. And so from your standpoint, would you say then, I mean, looking at that brain scan, it's very obvious which one kind of has more going on, that it's just common sense really to increase the levels of activity in our students?
I think it is, and I think that we have ample evidence on learning, that it impacts learning. What I would like to see physical activity become is a part of teaching. We have response to intervention. We have teachers that use centers. We have teachers that use smart boards, and physical activity is one of those, another component, another way of teaching that offers benefits for cognition. I think if we were to go back, and I was talking to a colleague about this recently, and we were to take schools and completely wipe clean, we have no idea what a school should look like, and we take all of the evidence, I don't think there's any doubt that physical activity would be an essential component of teaching, because it's that important to get kids up and moving.
So let's briefly review some of the terminology that you're going to be using throughout our discussion today, because I think there's several terms that we tend to throw around that maybe people use interchangeably, but they actually mean different things.
Absolutely. What we're trying to do with a comprehensive physical activity program is to get kids physically active, and that is any movement that expends energy. That's what we want. We want students to be up and moving. The next step to that is exercise, and exercise is a form of physical activity designed to improve your fitness level. So those two are behaviors. Physical activity and exercise are behaviors. Fitness is an outcome. And oftentimes we say, okay, we want a comprehensive school physical activity program to get kids fit, when the reality is we want a comprehensive school physical activity program to get kids physically active. Focusing on fitness has other issues, and there's other factors that impact fitness level, but if we can get kids just up and moving, that's what we want.
So when we're looking at these terms, would you say that physical activity is kind of an umbrella term that encompasses a number of other components?
I think it is, and I think it's this overarching physical activity, and there's lots of different ways. Exercise is one form of physical activity, but so is dance, so is recreation activities, sports, and I think particularly in physical education, but in other areas that we need to be promoting a variety of physical activities, not just exercise, because exercise has the connotation of you're trying to be fit, and we want to get kids physically active.
Now, how do schools begin incorporating and promoting physical activity within their schools? What's the starting point look like?
Well, I think first it is recognizing, and I know schools have a lot put on their plate, but recognizing that schools are a leader in this, in physical activity promotion, and then understanding that our goals have to be designed for the big picture goals for schools. Schools have academic performance and other things that are important for them as well. And so if we look at the cost effective, we need to make them unobtrusive, can't get into other areas. Sure. User-friendly, ease of use, and also making this sustainable. To go in with a grant for $1 million and get kids active and then leave and nothing's sustainable, I think is a disservice to students and schools. And I think we need to really include what schools need, and that's where this whole idea of a menu and being multifaceted comes in, to make it user-friendly and usable for schools.
That makes sense. And so who's kind of the person behind all of this? Who leads the challenge of bringing all of this to the table?
I think right now that's the big question. I think that we need a physical activity champion at a school. Okay. I think most of the schools that I've worked with that don't have a designated champion really struggle. There are trainings and things out there right now for a physical activity leader through Let's Move Active School, and it's designed to train people to take that role of a leader. I would like to see it be the physical educator. I think they're in a great position. They have the training, they have the resources, and they understand schools, and I think that's a great place. If there's not that available, there are other folks in the schools that can do that with health educators, nurses, extension agents, things of that nature. And I think that we have to take on, as physical educators, take on this role to show that we are more than just the guy in the gym or the lady in the gym. We're outside the box, and we're trying to promote, and we are the champion. But I think it's also important to understand that just because you're the champion doesn't mean you're the Lone Ranger. There's other people in there that have to be helping as well. And this idea of it takes a village to raise kids, it takes a village to promote physical activity as well.
Absolutely, and that ties back in with the whole Let's Move Active Schools campaign.
Absolutely, and that's this prompt, this visual that shows that physical education is the foundation. That's where it starts. But then there's lots of other ways. In some schools that, if you don't have a lot of parental support in your school, family involvement might be not something you go for right away. But if you have classroom teachers that would just love to get their kids up, and you have a few classroom teachers that can see that benefit, I think that's where you really get the ball rolling, and that's where a champion can come into play.
So really looking at where are the areas that folks are supportive and kind of tapping into what resources are available.
Absolutely. I think that's essential to get the ball rolling. And then other areas could come along, and that could be where we move into, you start with classroom activity, and then you can, okay, now we're going to do recess and move forward in that way.
Great. Now, you say that physical education is the foundation. Can you talk more about what quality physical education is?
Yeah, I think it has to be the foundation, and it has to be quality. If a principal comes and sees, kids running around with no structure, no teaching, they're probably not going to be supportive of a comprehensive physical activity program. But a standards-based program, we have national standards. There are 5. They're based on physical literacy. They're through the National Association for Sport and Physical Education. And I think that they help develop a standard-based curriculum, but have to be implemented with best practices and an emphasis on focusing on physical activity and being student-centered. Not saying that physical activity is the only outcome. We have skills, we have knowledge that we're teaching, but we're teaching them through physical activity, and we're providing kids with the skills, knowledge, and attitude to be active for the rest of their lives. And we know with some research that a colleague of mine did at University of Hawaii, Chuck Morgan, that if we get kids active during physical education, a 30-minute lesson can mean as much as 20% of a kid's physical activity levels, especially the low active kids. Some of the kids in our study were getting 1,000 steps a day outside of physical education. So without physical education, they were getting 1,000 steps. With physical education, it was up around 3,000 or 4,000 steps.
Wow.
Yeah, so it can impact, and that's the thing I think we need to really emphasize.
Absolutely. Now, you also suggest going beyond this quality physical education program, also looking at how can we incorporate physical activity in various ways throughout the day.
Yes.
Can you talk about some of the suggestions or ideas that you have?
Yes. The first is classroom-based physical activity, and I think the initial barrier is we have to get students to do better on academic tests, and there's evidence to support that more time for physical activity during the school day doesn't decrease that time, and I think that's important.
Yeah, because I would think that would be a big pushback factor.
Yes.
Is we have to, it's testing, and
there was a study that gave students as much as 8 hours of physical activity during the school week, and most schools, at least in my daughter's, they get 3, and they found they didn't have any decrease. So I think that's essential, and I think that we can have these breaks, and I think there's different ways to look at these breaks, and the breaks again can go back to this remove inattentiveness and decrease behavior problems, but they can be to integrate academic. They can be just because the classroom teachers we've worked with said that they can see kids when they start to get fidgety, and they get them up, give them a break, and they can sit them back down, and they can calmly start learning again.
You also talk about different ways to structure recess and things of that nature. Can you talk about that?
Recess is another one I think we need to make better use of. I know it's being cut across the country, and lots of places are decreasing the amount of recess time, and I think we need to be a lot more efficient with the recess time that we have. We have data that suggests that we're getting less and less time for recess. I know at schools where they give students a half hour of recess at the end of the day. That doesn't do a lot of, I think smaller breaks throughout are a lot better. I know of schools that have policies that you can't take away recess, which is great, except for the classroom teachers make the students walk laps. And that's not taking away their activity, but they're taking away the true spirit of recess is to let them have choices. So using recess as a reward, I think there's some of these unintended consequences that arise that ultimately can turn students off to physical activity. And it's good intentions, it's just we have to be careful. And I think the biggie is helping organize this and having some type of physical activity that works. And that's where the research suggests is looking at what works. And I have a colleague we worked with at the University of Nebraska, she's at Arizona State now, Jen Huberty, and we looked at recess and we looked at a variety, we looked at the research and found that activity zones work, giving kids recreational equipment, things like playground balls and jump ropes, that works. And then we went in and trained some staff, and we know that works as well. And we found that these relatively low costs, I mean $1,000 for equipment isn't a lot of money. in the grand scheme of things, and that can be used to maximize the amount of time that we spend at recess. I think we have to be clear of that.
And what about activities or efforts that are being made to increase activity before or after the school day?
I think these are times that are missed. I think sometimes, it's an after-school program. It's babysitting. But there's a time that we can really get kids to be active if we're efficient. And we know that I have a colleague at Michael Beats at South Carolina is doing a lot of work with after-school programs and showing after-school programs how to be efficient with their time. And he's collaborating. He's doing healthy eating as well. So he's collaborating with supermarkets and getting healthy snacks at a reduced rate. Some of the programs I've worked with have got teachers involved, and one of the things I would like to see is a physical education teacher to be involved with the staff and show them these are activities that kids like during physical education, and they'll be more apt to do this, how to manage kids. And then I think one that's it's a hot topic right now is joint use agreements, where a lot of areas where the gyms close at 3:30 and aren't used, and that would be a great place for adults or kids to be active in the evening hours.
Absolutely. And then also there's things, when I was a kid, everybody rode the bus to school, and that might be a factor of where I grew up, but that's not necessarily the case everywhere, and that's a way to increase activity too, right, is thinking about how we actually get to and from school.
Absolutely. A colleague of mine in England has done research that showed that kids that rode there, they had like a holding tank where kids were held when they got to school. And they found that the kids that rode their bikes or walked were more active in that holding tank than the kids that were passively transmitted. So there's safe routes to school, there's walking school buses, there's lots of different programs out there to maximize activity and get this incidental activity that is just as much health benefits as other activity.
Great. And then you've also mentioned intramurals, fundraisers, things of that nature, just other creative ways to...
Yeah, I think intramurals has this connotation of being sports, and it doesn't have to be sports. It can be ultimate frisbee. It can be a walking club. But then there's also ways to raise money with, for example, I know selling pedometers has been. Some schools have had a lot of success with selling pedometers, and as opposed to selling cookie dough or those types of things. So I think those are, and again, what that can do is those funds can help support the comprehensive school physical activity programs.
Sure. And that ties in, actually, in January, our show talked about healthier foods in the schools, and that was one of the things they discussed as well, as looking at fundraisers, and if we're trying to get kids healthy in the schools, why are we having all of these bake sales, selling cookie dough, selling donuts, things like that. So now one of the things you mentioned early on in the broadcast was the idea that it takes a village, that it should go beyond the physical activity or the physical education teacher. So who else could we really get involved in trying to promote physical activity with the students?
Another component of the comprehensive school physical activity is family and community. And as the foundation of the family is the parents, and we know that parental support will get kids to be more active. And it's not just, the parents don't have to go out and run with their kids, just supporting their kids and being active will get them more active. We know if we can get parents involved and bring them in, they'll be more supportive of showing what we're doing in PE.
Sure.
Physical activity homework, activity calendars, there's a variety of things. One of the things that we did when I was teaching is we had an active open house where we let kids have a pedometer or parents have a pedometer, and then they wore it during open house, and then they returned the pedometer, hopefully, and then we would give them a pamphlet, and we'll talk about the benefits of activity, just things you can talk about at the dinner table, or just things to get kids thinking about physical activity that, frankly, we were finding most parents didn't know. It was a great idea just to get families involved. And then the next step beyond families is all the families in a school make up the community. And I think there's lots of ways to get the community involved, as I talked about with after school programs and parks and rec, rails to trails. I don't know how prevalent they are around, but they take old railroad beds and make biking paths out of them, which a lot of old railroad beds are by schools, at least in Kentucky, because they were cheaper land and you could build a school there. We know that if we can get involved with wellness centers, business-sponsored PE, lots of businesses now are looking to go in and volunteer in schools, and they can help with recess. They could be the recess supervisor. They could help with a classroom break. They could supervise an extra activity break, those types of things. I think if we can get beyond just focusing on the kids in schools, that we can have an impact.
Sure. Now, so getting the family involved, you've got a number of ways. Getting the community involved, you've got a number of ways. What about the other staff beyond the physical education teacher? What about the academic teachers? Can you get them involved? How do you get them involved?
I think you can, and I think it takes time, and again, I think it takes a variety of approaches. One of the things that we've found is that as physical educators, we can reach out to them and say, you know what, you're a valued colleague, we care about you, we're going to do some wellness things for you. We're going to have a contest. I know some teachers that have done a stepping contest with pedometers. I know of a teacher that it's called the Goose, and it's to get out of school early, and she worked with her principal, and the teacher that did the most activity breaks or had the most kids show up to the PE demo night or whatever the situation was that month got out of school a half hour early on a Friday, and the principal went and watched their class. She painted a goose gold. It was she said it was unbelievable how many parents they had show up to demo nights because they promoted it a lot more. And we know that this is related to teacher dropout and that teachers are stressed. And we need to give them opportunities, whether it be a brown bag at lunch, it could be just a note in their mailbox that says, you know what, if you drink in a bottle of water, it says, if you drink this bottle of water, there's health benefits. Try sleeping more. Those types of things that can be just little things that can help teachers and again, build morale and build community within a school.
Absolutely. That sounds terrific. I think the more you can get the teachers on board, then they're sharing those messages, then the kids are bringing the messages home to their parents, and it all just kind of snowball effects from there.
Absolutely.
So considering, we've got a lot of great ideas we've talked about, if a school, someone from a school is watching this broadcast and thinks, I'd like to start this, I'd like to begin getting more involved, how would someone really get started developing a more comprehensive approach?
I think the first step is to have someone designated as a champion. It could be a committee, but it's typically one person that organizes the committee. I think with the respect to the village, is having a committee, having teachers that are interested, not someone that's browbeat to come to the meeting, but someone that's interested in this, and then start small. I just from experience, trying to do 5 or 6 different things at one time, it's better to start with one thing and do it well. Have a long-term plan, but know in short what you want to do. And this is all included in the CDC's Comprehensive School Physical Activity Program guide that's available online. But and the key, I think, is also to be persistent. You're going to hear no. I've done parent nights with no parents. I've volunteered to do coaching workshops and no coaches showed up. I've done this, but then the next year we would have 10 or 15 people show up. And I think it's just important to be persistent. It's like anything. You're going to hear no a lot. You're going to hear this will never work. Yes, it will. We know it works. It's just a matter of being persistent.
Great. Now, when you start to pull it all together, can you give us an example of what it might look like to show a comprehensive school physical activity program?
Yeah, I think the idea is to make sure that we've, again, starting small, but pulling this together. I think that when you look at a lot of the research, there's data to support this idea of how kids will be active. And I think if we say that kids will get, for example, we'll say that kids will get 60 minutes of PE. I don't know what the average, I don't know what it is in New York, but in Kentucky they get about 60 minutes. So if we say that they'll be active for 60 minutes, then half of that is what the expectation and what the research suggests they will be active. So that would be about 6 minutes a day. And you can see on this graphic the classroom activity, and this is again what research would suggest. And you can see at the bottom the total physical activity is minutes per day offered is 73. And if again, this isn't just offering it; these are interventions that were done strategically and done intentionally. But you can get kids active about 50 minutes. Now that does include before school programs, so it would be a little less. But I think that there are ways that we could do it. And really, I think for most schools, the only thing different here is the classroom breaks, which, again, as I've argued earlier, I think that's an essential part of a way to teach. It's not necessarily we're doing it for health benefits, it's a cognitive benefits as well. So I think if we do this from the research perspective. Now, what hasn't happened is research that implements all these simultaneously and to see what happens with that, and that's being worked on now.
Excellent. Now, in your experience, in developing these kinds of programs and seeing schools make these changes, what kinds of responses have you gotten?
The principals that I've talked to are the ones that really shocked me. And this was early on in this. I've talked to some principals recently, but the principals, and again, this is just anecdotal, but they talked about it being a culture. We were working with some schools in one area of a district, and so all the principals meet at their district meetings, and all of a sudden we were getting phone calls, hey, we want to be a part of this. And one principal said, this was when No Child Left Behind was prevalent in schools, and he said, No Child Left Behind changed our schools. He said, but this changed the culture, that we can show parents we care about your kids more than just feeding them knowledge. We care about their health. We care about them long term. And and they've said it's changed their school. Most of the time, the principals will come tell me that you don't know how many times the parents say, we didn't do this when I was a kid. and they didn't. I mean, they did bits and pieces of it in some parts, and I think that approach is, again, reaching out to parents and showing education is different than it used to be. And that's what we want to do with this.
Great. So all of this sounds very positive. I mean, you've laid out quite a few different benefits, both health benefits and academic benefits, and it seems like the folks who have gotten involved have had a good experience. So what would be the take-home message that you would want to send to our viewers?
I think first and foremost is we know that there are health and cognitive benefits to physical activity. And that means that getting kids active during a school day is a win-win. I think that the big picture is that the term comprehensive school physical activity, it may go away. It might be something different, how in education things change quite a bit. But the concept that physical activity is good for us is not going to change. And I think that we have to keep pushing this because we know they're going to be healthier, and that we know that when we implement this, there's implications for attention, there's implications for concentration, there's implications big picture for learning. And I have written on the slide the wave of the future. It's here now, and I think there's a lot more support being groundswell of support. And I think this is something that's here to stay, and hopefully something that we can implement and get kids active and make them healthier and better learners.
Excellent. And I certainly share that hope too, that this really is a movement that's going to continue going forward. Now, if there are there resources that you would like to share with our audience, or if folks wanted to learn more about this and just wanted to go somewhere online and find out more information, anything in particular you would share with our audience?
Absolutely. As I mentioned earlier, the CDC has just more information than you can digest, and you can see those on the screen. The Comprehensive School Physical Activity Guide, which is a step-by-step, it provides the research I've talked about, it provides ideas. There's healthy eating and physical activity. There are guidelines for those, and again, there's just the endless line. And I think New York has some specific resources as well. This is what I mean by this groundswell. I mean, most of these are relatively new resources, and I would highly encourage the audience to go out and look for these resources because they're everywhere.
Great. Well, thank you so much for everything that you've shared with us today. I think this really is a great movement that we have going forward. Now, you've kind of presented to us the big picture from a more national perspective, and now we're going to hear from a physical education teacher here in New York State, Tom Winicki from Mott Road Elementary School. As the NFL Network Physical Education Teacher of the Year in 2013, Tom has great ideas about children's fitness and great plans for turning those ideas into reality. Let's hear what he has to say. Hi, Tom. Thank you so much for agreeing to meet with us today. We're very excited to be here. If you would just start by telling us a little bit about the school that you work in.
Well, this building is Mott Road Elementary School. It's one of 3 elementary schools in the Fayetteville-Manlius district. We're a suburb of Syracuse. And all 4 buildings are kindergarten through 4th grade.
Which sounds terrific. And in your role as the physical activity or physical education teacher, one of the things that I understand you want to get your students to understand is why it's not just important to exercise, but how they can learn to actually enjoy exercise. Can you talk to us a little bit about that?
Well, a big part of our curriculum is to teach them how this helps them physically and academically, where we try to influence our kids and teach our students to enjoy the process. That what happens when they exercise, their body physically heats up. They start to sweat a little bit. They start getting huffing and puffing, rosy red cheeks. That those are things that we teach them to embrace. So they're not reasons to stop, but rather it's a signal that says, I'm ready to get stronger. My brain is getting ready to learn a little bit more. But when we put together our curriculum, we wanted to avoid the argument of, I like teaching this, I want to do this. You like teaching this, this is what you do. No, we wanted to get beyond those arguments, and we held ourselves to national learning standards. And we used some software to map our curriculum, just like any other curriculum in our district does the same thing. And we have essential things at each level, essential questions we ask that this is exactly what we want to do. And when we presented it to our school board, I looked right at our superintendent and I says, we are holding ourselves to a higher standard than you. And she smiled, but she got the point that what we're doing is beyond what we think is important. It's what the United States of America says our students should learn. And our activities are based on grade level benchmarks. And you'll hear us refer to our students, this is what a fourth grader should be able to do.
One of the things that I noticed when we were in your office earlier is you have these two signs on your door. One says I can't, one says I can't yet. Can you talk a little bit about why you have those signs and what they mean to you and your students?
There's so many reasons not to, that a lot of people come in, students and adults, if they try something and they can't do it, that becomes a reason and an excuse to stop. And we try to turn that around with all of our students, that nobody is allowed to come in and say, I can't. And we tell them this the very first day of school. I say, if you come and say, Mr. Winnicky, I can't do this. I says, I'll look you square in the eye and I say, you're right, and I'll walk away. I can't help you. You've made up your mind. I can't do this anymore. You've closed your mind. And we turn that around and say, now if you come up and say, Mr. Winnicky, I can't do this. I'm trying. I just can't do this yet. I'll look you right in the eye and say, show me what you've got so far, and I'll see how I can help you, because that's my job. There will be a lot of times that I will help you, and there'll be times one of your friends will help you. But you can't do it yet is a signal to say, I can't do it today, but I'm coming back tomorrow, and I have another chance, and I'm going to get this.
Now, so one of the things that we as adults tend to talk about when we look at advantages of physical education, we're thinking healthcare costs, we're thinking childhood obesity, but how do you talk about subjects like that and make a child understand why this is important? How do we relate those things to the elementary population?
Well, first off, when those things come up, childhood obesity in the news, or rising healthcare costs out of control, none of those things ever pass the school budget. When people look at their school budget and their tax bills, how is this going to affect me now? And it's so difficult to measure a student's output at a specific point in time. The raw material that comes in is not what comes into a production, like a automobile plant. It's not the same. We have control over them for 6 hours, and then there's 18 hours on their own. So we do as much as we can with the time we're here. From my point of view, cutting things like recess, physical education, art, music, those type of things are short-sighted. They may save money in the short term, but in the long term, you lose sight of the big picture. Again, you can't measure a kid's output instantly at one point in time. You just can't. You can look at trends and you can look at things like that. But the other things that come into play, what I can do with my students, what a music teacher, arts teacher can do, or what they can learn at recess on their own when it's unstructured, is so valuable. We can teach the kids, and we do. We talk about how exercise helps them physically. And yeah, we can develop our skills so we can learn to enjoy something, and I can be physically fit, and I'm less likely to be sick from school, and I'm more likely to be able to be more active at recess, and when the whistle blows, I say, is it done already? As opposed to getting physically tired and have to stop, and when are they going to blow the whistle so we can go inside? But also how it enables their brain to learn more efficiently. I showed you the two brain scans of a student who's been sitting idle for 20 minutes and one who's been active for a period of time. And you look at those and say, which one of those two would you rather teach as an educator? And the answer is obvious. And we relate that to our students by saying, if you get sweaty today, if you get the tired, heavy feeling in your muscles, you get the sweat trophies, the rosy red cheeks, you will be stronger tomorrow, yes, but your brain will also function at a higher level for the next hour or two. Your brain has grown bigger. You grow more brain cells. The synapses, the connections between the brains increase. The brain cells increase. So you are able to learn more and more effectively when you go back to your classroom if you go back and pay attention.
So you would say that really including more physical education fits in with the bigger picture of increasing academic performance and things of that nature as well, and providing time for physical activity doesn't decrease from the ability to learn academics.
Absolutely not. There's been scores of research studies done that have come to the conclusion that if you take away time from an academic classroom and you put it in this case, in a physical education classroom, the time that was taken away, that someone loses their instructional time, but they give it to someone like me, and I enable those kids to move aerobically and incorporate aerobic concepts into my instruction, and then they go back to the classroom, it's in essence an investment. You give up 20 minutes, you're going to get 90 minutes of a higher quality of a student in your classroom. So now with the APPR things, and where classroom teachers are reluctant to give up their class to even a student teacher anymore. Now, if they give up, if you even look at it as giving up instructional time, and I don't even look at it that way, but you give me those kids for as much time as I can, I will give you back a better raw material to be an educator with, to tell you, now you go use your expertise and make those kids dance in your classroom.
Absolutely. Now, another trend we're seeing in education is the use of technology. Can you talk to us about how technology has played a part in the work that you do here at Mott Road?
Well, we started with pedometers years ago. I went to a conference in South Carolina one year, and I saw somebody present on using pedometers. And I came back here and presented to our HSA about it, and they purchased a class set. This is how I'd like to use them. Could you give us a class set of them? But it stopped within the framework of the class, because I didn't have enough to let this class take the pedometers away and have anything left for the next class. So it stayed within the four walls of my gym, which was fine to a point, but there was an artificial end to how I could use the pedometers. Last year I was very fortunate. I was named the NFL Network's Physical Education Teacher of the Year. What came with that was a $5,000 grant, which I was able to use, and I talked with my partner and another physical educator in the district. All three of us are nationally board certified. And we decided pedometers for an entire 2 grade levels to use was the best use of this money. So now my 4th graders this year in the building wear pedometers from the first day of school to the end, and they wear them all day. When they get to the building, they put them on. At the end of the day, they have a booklet that they record their steps in. And in working with the classroom teachers, we decided to carry out place value to 1 million, because that was a Common Core math standard for them. So they can use those numbers any way they see fit in their math or social studies instruction, and I use them with the kids. How many steps do we get a day in school? And we used some research that found that the President's Council on Physical Fitness recommended 11,000 to 13,000 steps a day for an elementary age child. So we put that out there. That's the goal. And we get to X by the end of the day, which leaves us a certain number. And every student's number is different. So when you go home, you in essence have homework to do. You have physical education homework. And we go back to what we do in class. Or some of our kids have electronic equipment like Dance Dance Revolution or Just Dance at home. And we use that at school. And we have kids go out and we record how many steps they have outside at recess. What did you do at recess to get 2,621 steps? So now when they go home, they now have a bank of things to choose from. Well, if I need 2,500 steps, I can do this. And I can get it done in a half hour and my homework is done. And I had a good time doing it.
Now, in your school, from what we've seen so far and what you're going to talk about, there's quite a few ways that you incorporate activity throughout the day, from fitness walks to the pedometers that you discussed. So I'd like to spend just a few minutes talking about a number of these different activities that you incorporate. So can you talk to us about a fitness walk that you have here at the school?
Well, this was started half a dozen years or so ago in a way to try to meet the state physical education mandate, increase more minutes. The schedule didn't allow us to have kids every day. I would love to have every one of my kids every day, but logistics doesn't allow that. So we had to come up with a plan B. And we figured out minutes, and we met with the district administration, and we decided this was our best option. Every day in the 3 elementary schools, after morning announcements, there's a morning activity time, and it turns out to be about 5 or 6 minutes every day. In our building, we have a fitness walk. The kids walk the right-hand side of the hallway and they walk the footprint of the building, and it takes them about 6 minutes to get once around. And in discussions with the staff, initially the thought was, you're taking instructional time away. We talked about that a little bit. And the suggestion was, let's just do this at the end of the day. Get the kids ready to go home, get their coats on, put their seats on top of their desk, we do the fitness walk, they get all excited, riled up, they go on the bus and go home. But that's not the point. The point was to ready them to learn for the day. And we showed them the brain scan, and we talked about the research. And to be very honest, they reluctantly agreed. And over the course of time, they realized that they don't become riled up. it's an instructional time for me that when they do, tell me who they are, and I can re-hit the instruction with them that this is a way to ready your brain to learn. And I start the announcements every day over the public address system saying, time to get your heart pumping and your brain ready to learn. And we pump the music in the hallway and they go.
Now, you've talked to us a bit about the use of pedometers in the classroom, but can you talk more about the different dancing games? You mentioned having the Dance Dance Revolution. You talked about it a little bit with the pedometer use, but can you talk about how that fits in with the day?
Well, this all started years ago. I have a relationship with Syracuse University, and the lady who was the head of the physical education department there, I saw her at a conference and we started talking about it, and she says, you know, I have 2 of these pads at school. We don't really use them. If you'd like to borrow them, certainly. So we started with 2 vinyl pads and we used the gym, and the kids gravitated to it. And it got to the point where we wanted more. So my teaching partner, Corey McMahon, is an eBay person. He knows his way around there. So he was able to find some metal pads that we just purchased ourselves on eBay at a cut rate price. So we put them in our office. And there was a room next to our office that was just kind of dead storage. So we kind of acquired that room. So we made more stations and we set it up at recess. The kids could either go outside, terrific, go outside, have a great time, earn the sweat trophies, have fun, go. Or if you would rather not, this is an option, come inside at recess. And the lights are off, and it became a safe place because nobody's looking at you, they're looking at the screen. And they wore pedometers, and the software in the game tracks how many steps you hit in a row correctly. And if they got over 100, their name went on the whiteboard. So now they had a record to try to beat. And literally, they would cheer for each other when they broke a record. And the pads worked, and we had to maintain them, and we jerry-rigged them. We got them to work for a couple of years. And we brought the superintendent of schools in. Here's what we have. Here's what we're doing. These eventually are going to wear out, and they're relatively expensive. And here's what we do this. We showed them how they do their own math and how we tied into the social studies and the geography and how we talked about the fitness aspects to it. And she agreed to purchase them for all the buildings because of the way we use them. She was impressed enough. So now every building in the district has this equipment. And we use it every day at recess. The other elementary schools use it on a daily basis for the kids to come in to use. And it's tremendous.
Which is a really terrific message for them to have. Now, in addition to what you're doing as a physical education instructor, you also have a Taekwondo instructor who comes in and does classes during the school day?
He is one of the people that we enlist from the community to give our kids a bank of activities they can do when they go home. He happens to be in today and tomorrow, where he comes in and he takes over our schedule and he goes over some of the basics of Taekwondo. And what we like is he does it in the framework of personal and social responsibility, being respectful, making a mistake and making it a clue to helping you learn the skill better. And it might take you 5 tries to break the board, but you got it. Or look at how focused he is. He is ready to learn the next skill. Look at that, and then everybody else sits up nice and straight. And he volunteers his time to do this. And then what he does, he's a tremendous instructor. I learn from him when he comes in. That he will then come in for 3 weeks and run an after-school club free of charge.
So you're really taking what they're learning in school and finding ways. You said you only have them for 6 hours. What are they going to do with those other 18 hours? And you're really finding ways to make the connection so that those other 18 hours that they're not with you, they're aware of ways to continue their physical activity.
Yeah, and to enable them to say, Mom, can we do this today? Well, no, we're busy. We're going to go visit. Well, okay, then what about tomorrow? And so they don't pester their parents, but they're taking ownership at their level of what they can and can't do. Their community resource is their backyard, is their basement, is their driveway, is their friend's house. And what can I do to be Mom's not going to let me practice juggling in the living room because I might lock a lap, but she'll let me go in the basement.
Sure.
And I can use plastic grocery bags because I don't have Mr. Winnecke's scarves, and I can practice and do the same thing. Or I can do this. I can make this that we did in class. So to empower them to make those choices.
Absolutely.
Yeah. Any way that I can connect what we do here at home, and the ultimate response is when the parents come back in, whether they help us spot for apparatus or they come in for one of our grade level open houses 4 nights a year, that they say, you know, this wasn't like this when I was a kid. I says, you know, that's the best compliment you can give me, because it's not a gym class anymore. It's a physical education setting where the kids are learning to enjoy doing things that as adults sometimes we don't want to. It's easy to say I don't want to do it.
Sure. So you've shared quite a bit of information with us today, and I would imagine there's a lot of folks watching who might be interested in learning more. So are there ways that people would be able to get in touch with you? Are you willing to talk with folks if they're interested in trying to bring some of these successful programs to their own schools?
Oh, I'm willing to talk to anybody. I can learn from anybody, and if there's something I have that somebody else can learn. My email address is out there. Our website is there. You can contact me through there. Phone numbers, we have the voicemail here. If I don't get it during the day, I'll get you by the end of the day, and I'll get back to you as soon as I can.
Great. Thank you so much, Tom. It's been a real pleasure talking with you today.
You're very welcome. Thank you.
It was great to have the opportunity to go out and meet with Tom. Even from the minute we got there, the students were engaged in this PE Central Challenge where they're competing in trying to achieve these nationally based benchmarks, and you could see how engaged the students were and how active, and it was a really great experience to be out there.
It's exciting stuff.
So now that we've heard from both of you, we're going to take a few minutes to answer some questions from the audience. The first that we have is, how long does a student have to exercise to get that red effect that we saw in the brain scan, and how long does that red last in the brain for better learning?
It's a great question and way over my head. If you refer to the reference that I had on the slide, if it's not in there, that specific information, you probably could contact the authors and they'd be able to tell you exactly that information. I know there's some research ongoing now looking at what is that, is there activity that's too intense that it gets kids too fidgety and gets kids too aroused and then they can't come back down? Is it, and we have to match that with activity that has health benefits and other things and benefits for the brain, et cetera. So I know that research is going on, but I'm sure Chuck Hillman would be able to answer that.
Excellent. And just as a reminder for our audience, all of the handouts and slides for today's show are available on our website, phlive.org, and you can download the handouts so you can find that reference if you missed it during the show. Another question, do you have a model recess policy that you would consider to be especially supportive for comprehensive school physical activity programs?
I personally don't. I believe if you go on the CDC website and type in recess in their search engine, it will come up with some policies, especially recess policies. I did write a recess brief for active living research that has resources and ideas and things that could be incorporated into a policy, but I'm guessing CDC has some policy language that could be used.
Would you give some examples? You referenced during your discussion that teachers can incorporate physical activity in an academic kind of setting. Would you give some examples of ways that they could do that?
Yeah, and it's some ways that when we talk to teachers, they didn't want a complex lesson plan. They wanted something really simple. So there are cards and other things out there that are available. Things as simple as kids do jumping jacks. You have them stand and they do jumping jacks if it's true and squats if it's false. It's a way to review little things like that can be incorporated. I know of teachers that we've worked with that they were doing graphing and they looked down and noticed that their floor was all tiles, which is graph paper. And so the students, instead of marking on their piece of paper 1, 2, 3, 4, they took 4 steps on the tiles and then they went over 3 and then they had to measure that distance, and it's up and it's engaging and it's active and it's simple. I mean, what I've learned most is all the things I've worked with classroom teachers and seeing them, and they just start generating. We say, well, we designed this activity for science, and they say, nah, that doesn't work for science, but it worked well for math. And I think those types of just getting the ball started in this simple activity, like, hey, we could do this. Oh, what about this? And those types of things. We worked with classroom teachers a lot to get some of the ideas that we've created.
Great. Now, do schools need to pass a comprehensive school physical activity or CSPAP policy in order to start a CSPAP program?
No, I don't think you have to start it. I think it's, if someone wants to do it and get it going, go. I don't think that, one of the things that I don't, when I started getting into this and when I speak, I don't want to make this overwhelming paperwork and bureaucracy to get kids active. It's, if you want to get kids active, you're a classroom teacher and you want to get kids active in your classroom, look up some resources and get them active. I think there's and there's online resources available. There's all kinds of things out there that the kids just follow along with the activity and actors on the screen and things that can be done. So no, it doesn't have to be a a policy. I mean, ideally it would be somewhat created into the culture of the school and that kind of thing, and typically that takes a policy, but to get going, just go.
Just go. All right. And do you have suggestions for other partners outside the school that can participate in or on wellness committees?
Yeah, and I think it's a great idea, and it's a great question as well. I think that, for example, I know when we were doing some safe routes to school things and some walking school bus or walk to school day, we worked with sheriffs to make sure the roads, like in some of the rural areas, there weren't sidewalks, so we had to block off roads. Kids were dropped off. They had parents along the way, so parents are important to get involved as well as for people power. We've also had like I said earlier, local businesses that get involved, because the local businesses have, again, people power, but they also have potential resources and things like that. We've had, again, police, we've had parents are a big resource. We've had some field days and things where we've had nurses and things at one of the stations is to talk about safety and sun safety or hydration and things like that. So again, I think it depends on exactly what you want to do, but I would encourage anyone that wants to start this, don't look at it as this is my show. I think it has to be a variety of people involved.
Yeah, I think that's probably a great approach and goes back to what you said before about multifaceted and taking a village.
Yeah, and not everybody has expertise. I know of an after-school program that a mom, it was a yoga instructor, and she came into the after-school program and taught yoga for free, and the kids had never been exposed to it, had no idea what this was, and they loved it. And it's just, again, little things that start the ball rolling, and they started doing yoga more and that kind of thing. So.
And the last question that I think we have time for is, can comprehensive school physical activity programs help schools to meet the physical education and physical activity elements of their school wellness policies?
I think the thing to be clear about is that physical education is a part of the curriculum, and that physical activity is a health benefit and a behavior. So they are separate. I think that it can help enhance the quality of a physical education program as well as physical activity opportunities. But I think it's important to understand that physical education is the foundation of this comprehensive school physical activity programs.
Great. Well, I think we're out of time for today, so we've got through most of the questions, but thank you so much for being with us today. I think you've got a really great amount of information that we've shared with our audience.
Thank you for having me.
And thank you very much for joining us today. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain nurse continuing education hours, CME and CHES credits, learners must visit www.phlive.org and complete an evaluation and the post-test for today's offering. Additional information on upcoming webcasts and relevant public health topics can be found on our Facebook page. Don't forget to like us on Facebook to stay up to date. As a reminder, you can also download the companion guide to this webcast on our website, phlive.org. The companion guide will provide you with learning activities to help further your knowledge and understanding of topics covered in today's program. This webcast will be available on demand on our website within 2 weeks, and DVDs of any of our Public Health Live webcasts can be ordered from our website as well. Please join us for our next broadcast on May 15th, where we will discuss the changing landscape of mental health treatment in New York State. I'm Rachel Breidster. Thanks so much for joining us on Public Health Live.
Based approach to increasing physical activity in youth. Children spend more time in school than in any other environment outside the home. This is the time when they're establishing healthy habits that can last a lifetime. Physical activity behaviors track from childhood into young adulthood, and physical activity in adulthood reduces the risk for many chronic diseases. School environments provide the best opportunity for students of all abilities to participate in physical education and both structural and unstructured physical activities such as active recess, classroom physical activity breaks, and walking and biking to and from school.
What is the connection between physical activity and learning?
Children who are more physically active demonstrate greater attention, faster cognitive processing, and better performance on standardized tests. There's also strong evidence that children who participate in daily physical education exhibit better school attendance, a more positive attitude towards school, stronger academic achievement, increased concentration, improved test scores in reading, writing, and math, and reduced disruptive behavior. Research also demonstrates that aerobic exercise has the greatest effect on student achievement and cognitive outcomes.
And what about the connection for public health?
Healthier students are better learners. Higher educational achievement and years of schooling result in better health. This is due primarily to the link between better educational and improved work and economic conditions, enhanced social psychological resources, and the ability to pursue a healthful lifestyle. Physical activity reduces the risk for heart disease, diabetes, osteoporosis, high blood pressure, obesity, the metabolic syndrome, and on and on. It improves various other aspects of health and fitness, including aerobic capacity, muscle and bone strength, flexibility, insulin sensitivity, and it reduces stress, anxiety, and depression.
How does supporting the comprehensive school physical activity programs align with New York State's prevention agenda goals?
The prevention agenda has the goal that by December 31st, 2017, we hope to increase the number of school districts that meet or exceed state regulation for physical education, which means at least 120 minutes per week of quality physical education in elementary grades K through 6 and daily physical education for children in grades K through 3. Interventions for consideration include opportunities to increase physical activity before, during, and after school, such as active recess and encouraging school transportation policies that support walking and biking to school, and implementation, monitoring, and enforcement of the State Education Department's learning standards for physical education and nutrition in grades K through 12. There are significant short-term and long-term benefits to making comprehensive school physical activity programs a high priority in our schools. To be successful, it will require a collaborative effort with many partners, including state and local public health, education agencies, school administrators, principals, teachers, parents, and of course students.
Great. Thank you so much for taking the time to meet with us today. So Aaron, clearly as you described, there's support at the federal level and our commissioner has described the support that we have here in New York State. How do the schools feel about this? Is there a benefit to the schools in getting involved?
Yeah, as was mentioned in the video, that there's no doubt that healthier students are better learners. We know that. We have lots of research. I think we've known that for quite some time because there's been a role of schools in public health with vaccinations and school lunches and things. I think what we're finding out more recently with some research from BASH in 2010 that we have lots of educational relevant health issues, things such as pregnancy and vision and hearing, and the ones that I think are really important are this whole idea.
This really goes beyond the physical education classroom or what we used to think of as gym class. So can you start by talking about that?
Sure. I think it is. It's a much bigger approach than just physical education. I think physical education is a foundation, but a comprehensive school physical education program is an approach that allows schools to make a much more use of their time and getting kids active in a variety of ways, and this approach provides much more substantial opportunities to be active.
Great. So one of the movements to try to engage the larger community is through this Let's Move Active Schools campaign. Can you talk about what is an active school?
Yeah, the Let's Move Active School has really highlighted this whole comprehensive school physical activity program. The components of a comprehensive school physical activity program have been around for a long time. There have been people doing this for quite some time, and what this has done is it's brought it under an umbrella and allowed a more comprehensive approach to a more coordinated approach. And a comprehensive school physical activity program includes physical education, before and after school activity, physical activity during the school day, as well as family involvement and staff engagement as well.
So I'm going to play devil's advocate and say, why do we need such a comprehensive approach? I think, people my age or older certainly would say, well, when I was in school, we just had gym class. We didn't do it like this. So why do we need this comprehensive approach?
I think we've realized this for a long time, that all schools are unique and that all schools have a unique set of needs. And what we wanted to do with a comprehensive school physical activity program is essentially provide a menu of a variety of activities that schools can use to get students to be physically active. And it's multifaceted and it's comprehensive and it's a variety, it's a smorgasbord. Some things will work in some schools, some things won't work in some schools. And I think it's essential that we have a variety as opposed to saying this is the one way to do it. We need a variety of ways to do it.
And where is the support for this kind of approach? Is there, are there organizations or at the federal level? Are there folks? And welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluations at the close of today's program. Continuing education credits are available after you complete our short post-test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best meet your needs. As for today's program, we will be taking your questions throughout the hour by phone. Our toll-free number is 1-800-452-0662, or you can email us at any time throughout the hour at phlive.ny@gmail.com. Today's program is Comprehensive School Physical Activity Programs, Enhancing Student Success and Academic Performance. Our guest is Dr. Beighle from the Department of Kinesiology and Health at the University of Kentucky. Aaron, thank you so much for being here.
It's great to be here.
So we're going to be talking about comprehensive school physical activity programs this morning, and I would guess that if you were going to poll a random group of people, they would say, isn't this a gym teacher discussion? But I think you're here to start talking about how feel that this is beneficial?
Yes, fortunately, with the Comprehensive School Physical Activity Program, that has garnered a lot of support, and the support is coming from, like the National Physical Activity Plan has it as an essential component of the education sector. The American Alliance for Health, Physical Education, Recreation and Dance, or AFERD, and NASPE have created the first position statement and have revisited that position statement. So there's support is ongoing. The National Football League with the American Dairy Council has their Let's Fuel Up and Play 60, and then ultimately, more recently, the Let's Move Active Schools has created lots of interest with comprehensive school physical activity programs.
Great. So certainly there's a lot of support that you're aware of.
Yes.
Now, at the national level, we can see that there's support, and we also have investment here in New York State at the state level. We spoke with Dr. Shah, the Commissioner of the New York State Department of Health, about our state's support of comprehensive school physical activity programs and how it fits within the New York State prevention agenda. So Dr. Shah, why should we support comprehensive school physical activity programs?
Regular physical activity promotes physical and mental health and improves aspects of academic performance in children and adolescents. The National Physical Activity Guidelines for Americans recommend that youth do 60 minutes or more of moderate to vigorous physical activity daily, including muscle and bone strengthening activities at least 3 days a week. Yet in 2012, only about 1/4 of adolescents aged 12 to 15 met these national recommendations. In New York, less than half of students in grades 9 through 12 do some kind of physical activity that increases their heart rate on 5 or more days per week, and only 1/4 on 7 days a week.
And why is a supportive physical activity environment important in the schools?
Although schools cannot prepare a healthy and educational future generation alone, they do provide the best opportunity for a population